Hello, my name is Gabriel Baron. I'm a third year at the University of Chicago, and this summer I had the privilege of working alongside Dr. Lucas Sharma and Dr. Charles de la Cruz, looking at how your lung cells respond to a flu virus when they meet it for the very first time. You breathe about 10,000 liters of air a day, and somewhere along the lines you're going to come across a pathogen. This can be a bacteria, a virus, a parasite, and all of these things, they're out to get you. But have no fear. You have a very robust immune system and very smart lung cells that are keeping you healthy. But when I say lung cells, I really mean your epithelial cells. These are the ones that line the inside of your respiratory tract. When a virus is presented to the system, these are the cells that interact with it firsthand. But it's not just one of these cells in your lungs, rather, it's a system that's constantly and dynamically communicating with itself. When a virus is present, some of the communication can go as follows. Your cells can secrete transforming growth factor beta, which causes them to be large, irritated, and inflamed. Your cells can also secrete interferons. These are small signals that alert nearby cells that a virus is present, that they should get ready to fight an infection. Furthermore, a virus can induce reactive oxygen species. These are small, oxygen-based molecules that can cause other cellular processes to go awry. So if we understand this crosstalk between your cells, perhaps when you're faced with more infection, and when that infection is cleared, we'll know exactly what's responsible for that clearance. This summer, I studied all of this in the context of a chemotherapy drug known as bleomycin. While bleomycin has canonically been used to model lung fibrosis or lung scarring, I used it as a proxy to study these mechanisms and processes. My whole project started out with a simple observation. When I treated my cells with bleomycin and subsequently infected them with flu, I found that they weren't protected, which led to my big question, which was, how is bleomycin protecting against the flu? Is it through TGF-beta, through interferons, through ROS, or perhaps some combination? And why am I studying all this? Well, the CDC reported that this year's flu vaccine was only about 36% effective. And if you look at the track record, you'll see it's not so great. Since 2004, the average efficacy rate has been about 40%. If we understand this crosstalk between your cells, if we understand these mechanisms of immunity, perhaps we can rely less on antiviral medications, we can stop guessing what flu strains to tackle in next year's flu vaccine, and we can focus on the individual. We can bolster your immune system, we can help your cells do what they do best, which is fight infection. Thank you so much for your time, and I'd just like to thank my mom, the Biomed Surf program, the CDC lab, and all the surfers for making this summer so rich. If you have any more questions, please feel free to reach out. I'll be more than happy to answer them. Thank you.